Criticism is mounting of the South African government and what some are calling a failure to secure enough vaccines for the country's population. The development comes as the country posts record numbers of infections and deaths, and as concerns grow over a new, more infectious variant of the virus. Now, South Africa has so far ordered doses for roughly 10% of the population through the WHO's COVAX program. That's aimed at ensuring less well-off nations also have access to vaccines. But delivery is not expected until April. And critics say the government should have acted earlier to procure larger amounts from pharmaceutical companies. Now, government supporters, on the other hand, are calling for patience and accuse rich countries of buying up all the supplies. And for more, we're joined by Shabir Mahdi. He is Professor of Vaccinology at South Africa's Witwatersrand University and joins me now from Johannesburg. Welcome, Professor. How confident are you that South Africa will be able to secure enough vaccines for its people?
Certainly not confident at all that we would be able to get 67% of the population vaccinated by the end of this year. I think we'll be highly successful if we're even able to get 25 to 30% of the population vaccinated. And it's not just about a challenge of being able to gain access to vaccine at this late stage, but it's also about the logistics of being able to deploy vaccine in South Africa. If we really do target wanting to get 67% of the population vaccinated and start vaccinating from the 1st of April, we would need to vaccinate approximately 150,000 people per day, 7 days a week, for the first month. And after that, 300,000 people per day if we go for a 2-dose schedule.
Professor, what could the government be doing differently in South Africa?
Well, at this stage, it's the only thing that the government can do is to try to pursue bilateral agreements. But the unfortunate reality is that much of the vaccine that is going to be manufactured over the course of the next 6 to 9 months by at least the 3 companies whose vaccines have now been licensed by different regulatory authorities is already bespoken for. So it's unlikely that government is going to be able to be successful in terms of procuring large quantities of vaccine to meet the target of vaccinating up to 2/3 of the population.
Is the vaccine then, Professor, the only way to end this pandemic? What else can be done?
Well, unfortunately, we are stuck with what is known as the non-pharmacological interventions, and that is for people to continue wearing face masks, hand hygiene, physical distancing, and most importantly, probably, is outlawing mass gatherings, especially in poorly ventilated areas. And that is really a holding mechanism. It's not a solution to the pandemic. The only real prospects of bringing this pandemic to an end is probably through vaccination, unless we're willing for there to be huge loss of life if we try to get to herd immunity through natural infection.
Professor, how concerned are you by the new strain that's been discovered in South Africa? Will the vaccine still work?
So that's an important question, and fortuitously, we are having 3 studies that are currently underway in South Africa, and a majority of the participants that are getting infected with the virus in those studies are getting infected with this new variant. So hopefully in the course of the next 4 to 6 weeks, we would probably have a conclusive answer as to whether this vaccine, in fact 3 different vaccines, whether they protect against COVID-19 or not, that's associated with the variant that's currently dominating in South Africa.
Professor, would it be enough for South Africa alone to achieve herd immunity if the rest of the continent is trailing behind?
Well, I think it would assist South Africa in terms of limiting the type of resurgences. So even if there is inward movement of people, once you've reached some level of immunity in the population, you wouldn't get this sort of major resurgences that we're currently experiencing. When we talk of herd immunity, it's not about the virus disappearing. COVID-19 is not going to disappear anywhere, anytime soon, anywhere in the world for that matter, anytime soon. But it's really about trying to prevent this sort of resurgences that are being experienced. So yes, if we were by some miracle able to vaccinate 2/3 of the population by the end of 2021, we would possibly be able to prevent resurgences even with other countries not necessarily meeting the same sort of targets in the immediate vicinity.
All right, that is Professor Shabir Mahdi, Professor of Vaccinology at South Africa's Witwatersrand University, speaking to us from Johannesburg. Thank you, Professor.